Okay, we're on live right now. This is the Public Affairs, Public Access show from the home. Everybody's from home. We are part of this new era of this social distancing, the idea that we are now, because of the virus that has affected a large percentage of us, we are not meeting at studio, but this broadcast is going through the normal outlets that the Houston Media Source has available, as well as FaceTime and the other venues that are available. So we are being seen and recorded. Hopefully this will be an opportunity for people to just share and possibly give some insight. And tonight, because of the May being Mental Health Awareness Month, this is a very unique month for us as we come to the end of May. It's Mental Health Awareness Month. I felt like in the invitation to let those of you who are professionals, community leaders, share with us. So what I'm going to do first, I always like to start by getting some introductions. I have my co-host with me. She's going to introduce herself. Go right ahead, Susan.
Good evening, everyone. I'm Jacqueline Davis Gilmore. His other half.
Keeping me alive, everybody. I just want to let you know everybody got to have somebody. Okay, thank you very much. Then we're going to proceed right down the line here. Come on, next. Matthews, I think.
I'm Reverend Dr. Carl Matthews, and today I'm here representing the Houston Ministers Against Crime. I'm the Assistant Project Coordinator, and I'm glad to be a part of this platform and discussion on today. God bless everyone and look forward to a very enlightening dialogue.
Very good. Thank you very much. And of course, next we have a guest, Ms. Strauss. Come on, Ms. Strauss.
Hi, I'm Tina Strauss. I'm a mental health advocate trying to do some things in the community. I just graduated with my master's in psychology and counseling. Looking forward to going into the legal aspects and become an advocate, a lobbyist for mental health. Tina Strauss.
Very good. Thank you very much for joining us. And of course, one of our stalwart soldiers here in the city, Mr. Gordon.
Good evening, family. My name is Reginald Gordon. I'm a intervention specialist. I deal with at-risk youth around the city of Houston. I'm a part of a program called United in Peace here in the city of Houston. I'm the original start of the program that's all over the world called Operation Outreach Scared Straight, that work with young people, keeping them out of that juvenile detention center. Thank you.
All right. Thank you very much, Mr. Gordon. OG1, been out there a long time. And we have one of two of our elected officials as the councilwoman, one of the councilwomen, District D, Dr. Shabazz. Come on, Dr. Shabazz.
Good evening, Carolyn Evans Shabazz, and I am the current District D council member, and I'm always happy to be here to exchange with my Jack Yates brothers, Gilmore, Matthews, Dr.
Yes.
and Dr., and certainly my colleague, Dr. Letitia Plummer, and then OG1, and I look forward to speaking to all of you. And don't let me forget my soror, your co-host, which you say is your better half. She's really your 3/4. But anyway, because she's way past half, okay? Anyway, good evening to everybody. Glad to be here. Thank you.
Thank you very much. Thank you. And of course, our resident psychiatrist, Dr. Higgins, been around a long time with us throughout the city. And come on, Dr. Higgins.
Yes, my name is Dr. Napoleon Higgins. I am president of the Black Psychiatrists of Greater Houston, author of Mind Matters, a resource guide to psychiatry for Black communities. I do child and adolescent psychiatry down in the southeast side going towards Clear Lake. Happy to be here. Thank you for the invitation once again.
Thank you very much, Doctor. And of course, we have another one of our elected officials here, Houston, Dr. Plummer, who is one of our district leaders, well, at large. Come on.
Good evening, everyone. It is such a pleasure to be with all of you this evening. It's so good to see everyone's faces. And of course, my partner in crime, my council member over there, and Sarah and Spellman's sister. But it's so good to see all of you this evening. And I can't wait to have a good conversation about mental health and everything that's going on in the city.
Thank you very much. And of course, we can't forget our director, Mr. Mark. Mark is the director, okay, Mark, at the Houston Media Source, been there a long time. I'm not gonna say how long, but long enough that we done moved from location to location, but they're doing a fantastic job. Let's get right into it. I think my idea of tonight's discussion is, how has it affected you? How has it affected the position you've been in? I know, Dr. Plummer, I'm gonna start with you because you have been director. It was well made national news. In fact, one of the first people, I believe, in the city of Houston, of course, on the city council as well as around the country, really, that was affected. So how are you doing? Glad to see you. You're looking wonderful.
Thank you.
Back first.
Yeah, it is so good to be seen. It was very interesting. I tell people in a lot of ways, I feel like it was a spiritual experience. And I say that because, they call it, they say that we are quarantined, but it's true isolation. It is, the people that love you can't be with you because they'll get sick. And so you have to figure out a way to get through it on your own. And it really plays games in your head in terms of, because, we naturally, as human beings, we naturally feel that having a person next to you to care for you is the way that we heal, is the way that we get our good energy, is the way that we get the nutrients and support that we need. But when you have COVID, you can't have, because you love them, you can't have them around. And so there are days that you go through and it almost makes you a little bit crazy because you truly are by yourself. And you're fending for yourself. I was really lucky that I was able to stay home the whole time. But the moment I got sick, the moment I felt tired, I knew I had COVID. It wasn't a question in my mind because I still was a little confused about it, but I knew that something was wrong. And so as a mother, the first thing you do is you push your children away. You want your children to be in a safe space. And then the guilt that comes on you in terms of who you've been around, your council member partners. I mean, I was just playing in my brain, who had I seen in the last 14 days? Was I truly asymptomatic the whole entire time, or was I symptomatic immediately? Those are the things that kind of start going through your mind, and that protectiveness kind of kicks in. And then now I've been home for 22 days. Today is a special day because I got released from my doctor today.
Oh, congratulations.
Which is really great. But it is truly I will say this, if I wasn't mentally healthy, doctor, I would have definitely gone a different direction, I think. Because when your mindset is strong, then you're able to make sense of the things that don't seem to make sense, if that makes sense at all. But when your mind isn't strong, for whatever reason it may be, insecurity, depression, mental health concerns, loneliness, stress, whatever those reasons are, to not have the people around you taking care of you to kind of keep you lifted has got to be a place of complete devastation. So I'm grateful for my mental fortitude. I'm grateful for all the messages and love and prayers. I'm grateful for, because those are the things that kept me afloat, honestly, because you're in your room in four walls, literally 24 hours a day, making sure you take your medicine, making sure you remind yourself to drink some water, checking to see how many days it's gone since you haven't had food or drink, anything to eat, checking your body to see, by the fourth day, I hadn't had food or water. I knew in my mind that I was going to be in the hospital if I didn't get myself to the hospital. So having that mental fortitude to say, okay, get up, put some clothes on and figure out a way how to get to the hospital in the safest way possible. So those are the things that you have to kind of go through, but it is true isolation in every way, shape or form. And it's very scary.
Dr. Shabazz, you were one of those council members sitting there when the word came down. I mean, how did you respond as it relates to a colleague you've seen?
Actually, some of the things that Dr. Plummer thought about, I thought about now. When was I last with her? Was she sitting too close to me? Some of those things.
Yeah, it's true.
It's actually, you know, she had a lot going on. She was doing pop-up kitchens everywhere. And I did a couple of them together. And so that was the question. And then we've been reconfigured around the horseshoe, and she was actually right below me. And so she was probably one of the closest council members to me on the left side. And so it was something that I had to think about. And then the human mind is something else. You wake up in the morning, you say, does my throat hurt? Do I feel warm? You know, you start thinking about those kinds of things and wondering, do I have a cold or whatever? Well, one of the things that started this whole experience for me was a tragedy in my own family. My youngest brother, who I had been taking care of for about a year, he had had a stroke, and he died in March. And this was at the very beginning. And so it's kind of like, well, what do? You know, funerals bring closure, but you can't really have one, right? And so we were one of the first to try to figure out how to navigate some kind of ceremony and try to keep the social distance. So that was very difficult because, you know, people, you know, my brother was the mayor of Third Ward, right? And everybody knew my brother. And so consequently, so many people wanted to come around, and we literally had to keep some of the service quiet so that people wouldn't show up. Now, what we did, we were able to have a viewing at the funeral home, McCoy and Harrison, and they did a beautiful job. They kept people coming, they kept them distant, the whole thing. And then we had a private burial afterwards. Now we plan to do something later because, you know, we just feel like that's what we need to do to get to honor him. But it was a very difficult thing in the beginning of a lot of people having to do the same thing. And so, you know, and then just kind of running, because even if you're going through something, it's something about being elected that people expect you to shake it off and keep it moving. You know what I'm saying? And that's essentially what I ended up doing, shaking it off, and I kept it moving. And God is good. He's maintained, you know, my ability to do that. I have not felt badly at all. And I did get tested, certainly after the council member, you know, when we found out she was tested, even though I had kind of mentioned it before, but at first you could only go if you had symptoms. Well, it became a different ball game, and we all, I think mostly everybody got tested, and and I had apprehension about that because some people had experienced a different kind of testing and test site. Some people, they were actually tested with somebody putting a swab in their nose, which of course is not a comfortable feeling, but I was fortunate enough to go to one where I was able to administer it myself. And so you still wonder, did I put it in deep enough? But according to what they said, I did come back negative. My husband has not been tested, but he doesn't look like he has anything going on. So certainly it's quite a challenge, and especially when you're going out in the community like Dr. Plummer was, you know, trying to feed people and give masks and do all of those things and constantly washing your hands and all of that. And it's like, you still don't know how you might have gotten it because it's just that kind of disease. But certainly it was challenging. And as she said, you have to have a good mental state because this can really take you in a whole nother direction, especially when you think about it. It looks like a sci-fi movie, right? It's like, what's really going on? And then you realize that this is real. This is real, that it's in real time. So it's been challenging, but God is good.
Thank you. But Ms. Strauss, you have had a very unique experience being a mental health advocate. I think you've had some experiences. Your family, how have you dealt with it?
I think my previous experiences kind of prepared me for it, and along with my faith. My prior experiences have been way worse than COVID. So when COVID came along, I looked at this as another storm that I had to weather, and I put my faith in with it. So for me, just understanding what others have gone through has helped shape me into being more empathetic with others during the COVID virus. But because of my experiences, I wasn't too worried about it because I had my belief, like, God, whatever, at this point, because of all my other experience, whatever your will is, that's what's going to be done. And so I think he began to use me with others that had the fears of COVID and was really wondering. But it was my previous experiences that allowed me to be able to have the mental strength to even listen and be empathetic toward it.
Dr. Higgins, everybody has had these unique experiences with the mental dynamics. What have you seen? I mean, and observed in your position?
Oh, well, you see a lot, obviously just being a member of the community and, not only do people have their fears, but you have your own. You don't want to get sick. You don't want your family to get sick. My wife's a pediatrician. You don't want her to get sick, looking in the mouths and noses and seeing patients as well. So that overall community concern, that fear goes on. But then also just I've seen a lot of anxiety with this that's going on. And also the pressure cooker of, families being at home, the stress of kids going to school and all of a sudden that being disrupted, the damage that has occurred with them, so far as especially in adolescence and their identity is within what do they do? This is when you develop who you are and your memories and all of that being cut off, a lot of sense of denial, a lot of sense of loss, a lot of stress inside the homes within causing, relationship issues and things that were already there now all of a sudden being in a powder keg and being pressurized. So you're seeing a lot go on, with the community and with individuals, and it hits everybody. I don't even have anybody lying saying that, no, COVID didn't affect me at all. I'm good, I'm straight, I ain't worried. No, especially when we're trying to figure out what's going on, don't have a very good handle on things. And then, of course, with our lack of or poor leadership or poor guidance and leadership between multiple agencies from state, federal, local, and you're hearing different things in the politics, it just creates the stress to make it even bigger and bigger. And right now is not the time to be mentally ill. You want to be as mentally well as possible because everybody is stressed by what's going on.
What do you mean right now? Not the time. I thought it was never a good time to be mentally ill.
Listen, it's never good to be mentally ill, but it sure is not a good time right now. So far as you're not thinking well, you can't keep yourself safe, your family safe. If you're already depressed and you're already anxious or you're already manic or you're already psychotic, that paranoia and that fear is just more and more and more and more. The stress of not being able to get out of the house, the stress of not having the connections that we would normally have, realizing that as humans, we live on a vine. So essentially, one cannot live without the other. If you take a tomato and cut it off the vine, the tomato dies. And as we were talking about just now with having to be at home, the stress of having to be at home without those connections, it's not livable. It's something that is not doable. And it only can be done for a short period of time before everybody starts to lose it. So the stress of us not getting things together when I think we had everyone's attention and now things are just kind of haphazardly going about. I know myself, if I'm out a lot and I've got to go to the grocery store and I don't see people with masks on, I get anxious. All of a sudden I'm like, do I have a fever? And I'm worried about myself when I go out. So yeah, it's been very difficult for a lot of folk, and the stress of mental illness on top of this makes it worse. The stress of substance abuse already. Now you're stuck in the house with the alcohol is a problem. People are gaining weight right now. Families are fighting right now. So yes, it's a problem right now. If you don't have your mental health together as well as possible, things can quickly spiral out of control, even faster than for the general community.
OG1, I mean, obviously you've been on the front line this whole time period with some of your street activity. I mean, how do you see what Doc is saying?
Well, first of all, I want to say, God be good. Going back with me and my history have really helped me go through what I've been going through the last couple of weeks. Well, me personally, the last week or two, I've been in quarantine in my house because for the last 2 weeks, I came up, I'm a workaholic, and I took on a mission when this thing first come down, because I had been working with a lot of our young people that's in the Covington House, which is our homeless population. And, by me being a workaholic and have so much love for Black children, I took these 6 young people in to house them during this time of this COVID virus. And we housed them, we fed them, and we was taking care of them for the last 10 weeks. And by me being the coordinator over the program over there, I take on extra stresses in my own life because I got other things that I do, not only besides dealing with that young population of young people with the homeless shelter. I deal with the inmates in the jail. So we do recovery coaching with the inmates in the jail. So by me being a frontline fighter and being so actively involved, I had to remove myself last week because I felt some knots coming in my stomach. And when I felt these knots coming in my stomach, pain started coming on. I had been checking my temperature every day, so I didn't have a fever. But when I started having these pains in my stomach, I come home and my wife had to rush me to the emergency room. And when I went to the emergency room 2 weeks ago, they took all my vital signs. They did an EKG on me. They checked my organs. I did a blood sample. I did urine samples. Unfortunately, he said due to me having such healthy, not being involved in any other activities in my life, I had healthy lungs and stuff. They said I was in great shape. So I come home, but I couldn't eat. I still wasn't able to eat for like 3-4 days. I got real weak. Could starving for water. So I've been sitting in the house. Thank God, in the last week or so, I'm at a 99.9% back to my health. I'm eating good. I don't have no pains nowhere no more. I'm able to get up and move around. So I've been doing great so far. I took the test. The test had never came back yet. So it's been about 2 weeks since it's been about a week and a half to 2 weeks since I took the test. So it haven't come back to let me know whether I was negative or positive on the test. But my work is what it is. You know what I'm saying? What, just like the councilwoman said, due to my past and that my past experience in dealing with personal isolation and knowing how to deal with my own personal, and it took me through 20 years of prison, 4 years of solitary confinement, and the blessings of being in the world for 25 years and working with young people. My mental health have really helped me keep my focus, keep me strong, and making sure that I know the work is not complete yet. So I just want to thank my wife for nursing me back to health. I stayed up 2 nights straight, wasn't able to sleep. The stuff had me, I don't know what it was that had me just beat down like that, but I'm much better now and I'm doing great. But, and then, I'm a news junkie, and I'm always actively involved in being a news junkie. And by me working with and loving young men, by me loving young Black men and working with this population, due to all the things that's happening around the country, and not trying to keep my mind to not get caught up in the trauma that's affecting a lot of the young brothers around the country, dealing with the killings of young Black men. I try to keep myself away for me not to fall in the traps of getting caught up in this thing called depression, because I can remember one time in my young life, I got caught up in deep depression, and it was with myself about it. So other than that, I've been doing well. I've been doing a lot of reading. I've been putting myself prepared. So when I'm due let out this house, I'll be back actively involved in doing the work that needs to be done in our city. I'm looking for a new normal, not the old normal. We got to make a different change when we go back at it and deal with our young Black men in this community. So that's where I've been at with this thing. But work is never done, and I'm doing great over here. Thanks for inviting me tonight.
Thank you, Matthews. How do you see it from the church? I mean, we have been meeting in the church. Dr. Higgins was talking about the connected and everybody going to church. Trump told us to go to church, but we still ain't going.
Well, very good question, Doc. I think that we have not been able to attend the brick and mortar, the physical building as relates to the church, but the church certainly has not stopped its work. I consider myself to have been involved as a responder, frontline responder, because as death has impacted families, of course, they was discombobulated as related to not being able to have closure, as someone mentioned earlier, where their loved ones, I think Dr. Shabazz mentioned that, families not able to really plan appropriately without the guidance of spiritual leadership. So I was very engaged in many aspects. I mean, I think I did over 8 or 9 funerals and was ministering. And of course, the anxiety or the thought process of who am I going around? So what I did was I remember what grandmother said. I didn't lose my mind, first of all. Secondly, I invested in a thermometer, the one with the automation where you point it at the forehead, and I was scanning people like they was aliens to make sure their temperature wasn't 100 plus. And if they were, they could not, they could not come in. So, you know, there was just some, it's funny, it's comical, but yet it wasn't so comical because again, you want to take precautions and you want to make sure you stand healthy. Unlike many of you, I don't have the blessing of a spouse. So if I'm ill, then I'm just kind of on my own. And I remember sleeping bad one night and woke up, a chest was hurting and coughed and I couldn't hardly breathe. And I just knew COVID had gotten me. But I figured out in about 8 hours after taking the ibuprofen that I just had bad body aches. But the fear of that, what do I do? Where do I go? How am I going to receive services and treatment? Those, Dr. Higgins, I think you can relate, are realities for people who may have those symptoms or you hear so much talk about it that sometimes psychologically you almost persuade yourself that you might be having a slight headache, you're checking your throat. Those things can have some major contributing factors to how you function, you know. But we were able to sustain ourselves, you know, we were able to stay focused and we passed through it, thank God. We're still healthy, we're COVID free. You know, we just thank God for that. But yes, the faith-based church continue to move on and still had to minister with the people of God and encourage them. And we just had to take necessary precautions to make sure that we were not affected.
Well, I want everybody saw the paper today. The death count in America is 100,000. So we have surpassed many of the countries. You know, we are obviously in a better situation than Houston. But my wife had a question. She wanted to find out something going on there.
Well, you know, just from hearing all of you distinguished professionals talk, would you say that there's some type of commonality with perhaps some of us become a bit paranoid about this? Because I know I was in the grocery store the other day and I was sharing with Robert that there are certain aisles I wanted to go down in the grocery store, but when I saw more than one person on that same aisle, I pretty much walked around the whole store, came back to make sure that there was pretty much nobody on that aisle. And if there was somebody on that aisle, I checked to make sure that they had on a mask. And if they didn't have on a mask, I kind of gave them a look. Should you have on your mask? Shame on you. I didn't verbally say anything, but do you think that the paranoia is that common for us as human beings, for the paranoia to set in with something as massive and as tragic that this has become with COVID-19 in terms of mental illness, and how do we what's the word? How do we discipline and condition ourselves to not be so paranoid, but yet still be careful, but not overly careful when we do go out and engage in public?
Well, brother, let me add to that. With both our city council representatives, the mayor as obviously with the mayor's, I don't know if you call it a mandate or policy, but this weekend everybody saw the big parties going on. didn't have masks at the parties. What do y'all say about that? I mean, from a
I'm almost speechless because, of course, I live, near Alameda, where we have a lot of clubs and a lot of young people, and they're really not taking this seriously, and it's really, really frightening because not only do they not realize that they could get sick, they could be carriers to people who do not have whose systems may be compromised. But it's just like they've been it's like, well, we're loose and we're going to just get out here and we're going to hang out and party. And it's really, really a concern. And so certainly also, I didn't really feel the paranoia in the store. I just kept my mask on and kept it moving. But sometimes you'll turn and you'll scratch your face and you're like, oh my God, have I washed my hands yet? All that kind of crazy stuff. Let me get some sanitizer or something. Put it on myself. This is so serious. Well, you put it wherever you think you need to go, wherever you scratch, But the deal is, you really, this is not a joke, and you keep saying that, and then it's really kind of infuriating to me for the governor to override the local authorities, because it's kind of like he has marginalized the mayor and the county judge by making his own determination. And, it's like, at what point do you put people above politics? And so certainly, because the people that are disproportionately being affected are African American, you start kind of wondering, like, is there an objective? I mean, what is really going on? Do you feel like it's okay to lose a few people, just to keep forward and move forward and get back to work and whatever? So you do think about those things, but but you know what I did initially? I'm gonna say this. I'd walk by people and I'd hold my breath. Because it's like one thing for sure, if I don't breathe it in, it can't get in. And so I'd have my mask on. And I'm just gonna tell you, I'd go by. But being so ingrained in this, and I don't know if this has happened to anybody else, but I'll be looking at a show on TV and the people who start talking to each other, and I'm like, I wonder why they don't have on masks. But they filmed this show probably months ago. But you're wondering, because you become so involved in this and wearing your own mask that you're wondering, what are they doing without masks? And then you realize it's just a sitcom and they probably filmed this way before this. So if the mental state is something, you really have to grasp yourself and think about some of the things that you do. But it's the younger generation that really, really concerns me, because they have no respect for this virus, and it's frightening.
I appreciate the question, Dr. Gilmore, about how you differentiate between taking precaution versus paranoia. I mean, how should we gauge that, Dr. Higgins? I mean, you may have some perspective on that. How can we gauge that to know if we just taking precaution, we're adhering to the information that we're receiving, versus being paranoid as a result of this pandemic?
Well, I would say anytime you have fear, don't ignore your fears. So essentially, if your mind is telling you that something may be afoot or not quite right, you want to go with the side of caution. So essentially, I have walked into places. I walked into somewhere recently where it was a store, but it was a lot of people in there and very few had on masks. I decided I didn't want to go into that store. I turned around, left. There's no need to put myself in danger and not listen to my first thought. But part of the issue that we've had is there's so much bad information out there, and so much, when you have from the beginning, the scientists aren't talking. You have politicians talking about difficult science that we're trying to figure out. So the thing is that when we had everybody's attention, so much bad information went out that people really don't know what to believe. We didn't make the right moves in the beginning. And understanding that this is the biggest pandemic of our lifetime, per se, maybe, but the fact is that we did have HIV and AIDS, all right? We've had other airborne pandemics throughout human history. There is a playbook. People are trained on what to do. And we didn't do those things in the United States. And now we have a quarter of all the deaths in the world are right here in our country. And we're now opening up the country for more people to die. Now, obviously, it's adversely affecting people of color, but it's always adversely affecting people of color. Who do you think the indigenous Native Americans were? And for some reason, we always think that they were all Northeastern Euro-Asians. But the fact is that those indigenous people are us, and we're still being killed off and dying from disease. So the fact is that it is important for us to be cautious, but also it's a poor statement to blame individuals for being paranoid especially when so much bad information went out. The fact that this has been airborne, I don't know a doctor who went to medical school who did not know this thing was airborne back in February. And I have no idea why that information was not going out, because it was spreading too fast to be from hand to mouth, to be from contact surface to mouth, contact surface to mouth. You've got people all over the world with this virus, and as they're testing people, they're finding out it's bigger than what they're saying. I think the biggest lie has been that this thing started at the end of December, early January. For it to be this far affecting this many people, and for this many people to have positive and even antibodies, I think, my personal thought is a cover up between the United States and China, which basically my what I would think is that it was the issue of economics and greed. We didn't want to shut it down when we had the opportunity to. And you find that places that shut it down more are really, really back at it now. While our numbers are steadily increasing, and I don't really have a good idea of how to stop it now. I really don't. This thought about herd immunity and we're going to let a percentage of the people die is, to me, bad science. It doesn't have to go that way. We've never done it that way in human history when we actually had an opportunity to test, see where it's coming from, know where it's at, and basically safeguard those particular individuals. If it's not in your area, not in your county, you don't need to shut it down, all right? You do need to limit who comes in and who goes out, but the thought that either you're going to be safe or have a bad economy, no, you do both at the same time, and we continue to use bad information, which then people are just getting infected, and infected people don't believe that it's a big deal until somebody passes, or you start to feel that glass in your chest. And wishing that you were there because it hurts so much. That's when it's a serious at that point, or when you're burying somebody that you know. So we have to get out of this idea that it's not affecting us, it's not important. And we also have to get out of this idea that it's political to I'm sorry, I didn't go on, my bad. I done got fired up. Are you there?
Well, let me ask Dr. Plummer. I mean, this conspiracy concept.
Oh, sorry, I got on my soapbox.
Yeah, can you hear me? This conspiracy concept, was it in your mind? I mean, huh?
You lost.
What? I hope y'all hear me, but the point I was bringing out was,
how could we get it this
I
wrong?
think she's
conspiracy point.
Okay. Can you hear me, Dr. Gilmore?
All right, I will say you squared up. I can
Dr. Plummer.
question about
Can
conspiracy.
you hear me, Dr. Gilmore?
Right, I can hear you now. Come on.
Are we back?
Come on, Dr. Plummer.
Okay. I have a little bit.
Yes, we hear you.
All right. Can you hear me, Dr. Gilmore? Okay, good. I have a little bit of a different perspective, and maybe because I'm coming from the science. Okay. I believe that this situation that we're dealing with right now is very similar to all the other issues we've had in our nation in general. It's the lack of information and the lack of leadership. And it's the intention and the lack of a continuum of intention. So if the goal was to make sure that America survived the pandemic, if the collective goal was that we survive and do well, then it would be a whole different outcome. Everyone has an alternative political agenda. No one wants to be at fault. No one wants to be blamed for something not working out the same way or the right way. And so when you start with having such an issue at hand without everyone being on the same page, that's where the start of the problem is. And we could see, and you see that in everything. It doesn't have to be the pandemic. It can be racism. It can be inequalities. It can be, I mean, whatever we talk about. If everyone's intention and focus isn't exactly the same, then we all move in different directions. So at the end of the day, it's a lack of leadership and a lack of information. And believe it or not, a lot of it's intentional. If you don't want people to do well, then you keep information from them. We see that in our African-American communities on every single level, the inequities of healthcare. I mean, we don't do well as a culture because we don't get the right information. Whether it be because of internet limitations, because we are not able to read and conceptualize, because we're getting our information from Facebook or social media versus the news, regardless of what that reason is, we always are the last community to get the information. And when I say the information, I mean the right information. So how are we supposed to make good, solid decisions if we don't get it in time? And then our natural disparities, because we live in multi-family households, because we don't have good health care and have pre-existing conditions, because our children, have to be home with us, and we're, grandma's in the house and uncles in the house and aunties in the house, because we live in small spaces, because we're frontline workers, because we typically are minimum wage workers, because we live in dwellings that are not up to par from a standard of living perspective. All of those things set us back and make us predisposed to anything that's happening. The pandemic just magnified what we've been dealing with for decades. So I don't know why we're so surprised in a lot of ways. It's what we've been experiencing from hundreds and hundreds and hundreds of years. It's disparities. So what we as leaders personally, what we as leaders need to do is we need to find ways to get good, solid, scientific-based information to our communities. We can't be mad at our young people for moving around because no one's on the same page. The governor says to move around. The mayor says to stay home. People say wear masks, but private companies don't say you cannot shop here if you are not masked. Because our goal and intention is to take care and maintain the public health and public safety of our communities. If we all could get on the same page, this will look completely different. So once again, it's a lack of leadership and it's a lack of information. And we don't do a good job doing it. And it's no one's real fault necessarily, but we can't allow situations to keep on showing up and let's not learn from them. When are we going to learn that our communities are most compromised? And so when are we going to band together, making sure that all of the communication skills we have, whether it be our churches or our community organizations or our civic clubs, whatever those groups are, when are we going to figure out that is how we disseminate information? We look at all the leaders are on this call right now. We're all here having an intelligent conversation, accurate information. And until we do that and figure out a way how to do that from a cultural perspective, this pandemic is just going to be another one. It's going to be something else later.
Yeah.
Heart disease, cancer, diabetes, it kills our communities daily. Mental health. I mean, all of those things are things that we deal with every single day. So I honestly believe, guys, maybe it's because I have had this thing and I've been home for so long, but my perspective is no more excuses now. What are we going to do as a community we know what the problems are. So what are we going to do as a community to change it right now? No more passing the buck. No more saying it's someone else's fault. No more saying we should have done it this way. This is the same things happening in communities right now. So what are we going to do right now, here and now, to create some type of platform and plan that we implement on a microscopic perspective, neighborhood from neighborhood, church by church, community center by community center, to make sure that we get the right information to our communities so that we are strengthened and that we don't depend on other people to give us bad information. Someone said Black people can't get this. I mean, there's so many falsities that kind of are flowing around from a communications perspective that no one knows what to believe anymore. I just found out from my doctor the other day that if you get a COVID test, when I get my COVID test, when he swabs my nose, dead viral bacteria will still show up on my test, which means people really don't officially test out because there's dead viral bacteria in my nose. And when they put it and culture that bacteria, it can still show a positive test. Which means how can if I have to take a letter of a negative response, how can I go back to work if potentially my test can still show up positive? We have to tell that to communities so that they don't think they still have the disease. We have to give them guidance.
That may be the rationale. I know that the homeless are going into certain shelters, and I asked the question the other day. I said, are they testing the homeless when they get ready to come out? And essentially the answer was no. And probably for what you just shared, because they just keep you quarantined for like 14 days and then they let you go. So, which is kind of scary because you could still be carrying the virus, and then the homeless are going out there with other homeless, and then they are they spread it. But hopefully, they also have the antibodies or something at some point, but you just don't know who has the antibodies and who still has the virus.
Well, I think the problem too, if I may add, the problem too often is that you don't have the experts and the scientists on television talking about it, answering questions and giving the guidance that we need right now. These folks, I'm a psychiatrist, I went to medical school. We did have a class or a lecture on pandemics, so pandemics are not anything new. The problem is that as we're trying to figure out what the virus is doing, we don't have knowledgeable people who are actually being able to speak out and say what's going on. I would even say it now, on my own social media platforms, I'm trying to give good information to people, trying to dispel myths and things of that sort. But the fact is that, we only have so much of a voice as individuals. And when we don't have our collective body speaking up, you would think the CDC would be taking the lead, the American Medical Association, all these different virologists and immunologists and public health individuals. When they're not taking the lead, essentially, we don't know what's going on. And as stated, it was just so much bad information. When I heard on the news that Black people aren't getting it, this lie that young people don't get it is a complete lie. No, the majority of people who have this virus, at least 80-85% are below the age of 70. The thought that young people don't die from it. No, that's not true either. That's not true either. So there's still, so there are young people saying to themselves, well, even if I get it, I'll be fine. Well, it's estimated that a third to 50%, maybe even 80% are asymptomatic. But when you do have such a large portion of the population, even if it be 1% who could die, or I would say even 0.5%, we don't have the ability to treat that type of volume. And so therefore, you'll have people dying who do not have to, because the medical system cannot handle the volume of people who are ill. So this information still is out there that was wrong from the beginning. And the fact about this as a doctor is this: I don't know everything. That's why they call it the practice of medicine. We have to practice on how to treat the virus so that we can understand it better. If we don't know, we say we don't know. But when you have people pushing medications that don't work, and to tell you about the thing about politics and marketing, you had medical groups and medical doctors arguing on how you should write medications that haven't proven to work. Not only have they proven not to work, they've proven one particular medication now, and I won't speak its name, has shown to kill more people than it actually helped. And you have docs out there, because of the politics and because of the news and marketing, who are still writing a drug that actually may be more dangerous in COVID-19 than what it would save. It's not even placebo, it's killing people. So
the issue is that we need people who are professionals, who are unbiased, to talk about the science to keep us safe, realizing that pandemics are nothing new. What's new is our response to this pandemic. That's what's new.
You know, I have a great appreciation. I have a great appreciation from here. Yeah, go ahead.
Let me just say one thing. I did an interview with Dr. Joseph Gath, and I'm sure a lot of you know who that is. He is an infectious disease specialist, and he has been around a long time. We did an hour interview. I would really, really recommend for people to take a look at that interview. He gave true, actual information. So, y'all, we have the leaders here. We just have to make sure those leaders get in front of the people. We have people that know exactly what to do, and they know exactly how to. I mean, he sent me about 8 medications, and I did not take all of them at one time. I took them based on my symptoms. He coached me the whole entire time. I had a meeting with him every single day via Zoom. The problem is that a lot of people that are of lower socioeconomic levels don't have that level of access to healthcare. That is where the problem is. And so we have the specialists here. We have gurus in infectious disease here that know exactly what is going on. They're at the front line of creating vaccines. We have, as leaders, we have to make sure we get the right people in front of our people. Because they're here, they're accessible, they want to share the information. I mean, we talked about the whole entire process of getting COVID and how to recover from it on my little show that I did. Just because I know that information is valuable and crucial, and it is our responsibility to make sure it gets to the people because it is there and we know the problem. We don't know how to handle it all the way, but we know how this thing is being spread. We know what to do. We just have to all get on the same page.
Thank you very much. Let's Strauss, we get ready to wrap up. Give us a closing thought. This has been a humdinger today. Come on.
It's been a very interesting topic for me, and learning how everyone deals with the COVID. Just to hear everyone's perspective and thoughts on it is kind of giving me a whole different perspective. Like I say, my faith is what has gotten me through way before COVID. So with COVID, I was like, it's just another battle, even though it kind of interrupted some of the things I was doing. So it did create a little anxiety, but because of my past experiences, I knew how to handle them. However, my concern is, what about the individuals that don't know how to handle stress during this time of COVID? For example, domestic abuse is up. I just witnessed a couple of months ago a suicide. Just witnessed last week a young man go in and shoot 3 people. So I think our focus too is mental health during this season of stressful uncertainty. And that's my perspective.
Well, what do you think? I mean, obviously we've had some recent shootings and whatnot. You think that's a part of the stress? The suicide potential has been that whole time, but do you think it's increasing from the perspective you look at?
I haven't done any research, so I'm just going to give my opinion. When there's uncertainty with finances, if an individual have some mental health going on already, and then you have another situation, stressful situation on top of it, I think, yeah, it can play a major part in the mental health perspective of people not thinking rationally, and they're using drug use, from my understanding, is up. They're thinking irrationally because they don't know how to function in things that are no more normal or adjust to the new normalcy. And for me, I think that all has to do with mental stability from a childhood on up. Every life cycle, you're going to have some stresses. And if you're never taught from mental health experts or other people how to deal with stresses, it piles up and up and up on top of things. So when you have this thing that someone might see it as a big traumatic event, I always focus on trauma as being big T's and little T's. Well, a whole bunch of little T's can masculate into a big T, even though it's something that's a little T. So I think mental health needs to be addressed during this situation, as well as the scientific information, so that we can get out to the community and the public about how to take some of your life issues and not let situations like pandemics overwhelm you mentally.
Thank you. OG1, what your, give me a minute perspective on this idea you see and how it's affecting us mentally in these streets, man.
Yes, can you hear me?
You somewhere. Yeah.
Yeah.
I just want to say to the city council members that's there, you know what I'm saying? It was a great thing done in the day in Minnesota where the city council that declared racism is a public health issue. Until we get to the root cause of what's really going on overall with Black people, or how we deal with racism in this country, all the other issues that we talk about when it comes to COVID virus, till it comes to the prison system, till it comes to the school system. I said that one out of every 4 teachers are not going back to the public school system. We know that 10,000 young men are waiting to be released from the prison system. We got a bigger problem after the COVID virus. How do we handle the influx? 50% of the murder rate is up right now in the city of Houston. We have a problem on hand when this thing is released. And until we come together, for the last 30 years, I've been trying to put up trauma-informed training centers around the city to deal with these brothers that's dealing with this internal trauma. It was a study said that we are born traumatized. And until we deal with the traumatization that young Black men are dealing with nationwide, we're going to keep getting stepped on, looked at different, and treated different. So until we come together, like Sister Plummer said, and unite and come together with our minds, we will continue to be caught up in these traumatized positions and trying to save our family as Black men cry all over the world, I want to live.
Matthew, what about the church? We're going to open up soon or when? We're going to open up 30 seconds. Matthew, when we going to open up? When the church going to open up?
Yeah, brother. HMAC will be meeting on the 2nd of June, and I'm so appreciative of Dr. Plummer's passion and expression about the need to be transparent and disseminate information to communities, and all our professionals who pretty much express the same thing. I think with that, Gilmore, you and I have been marching and boots on the ground and talking about faith-based health and recovery to address the disparities in our community. And I think with leadership like these 2 ladies here and professionals like Dr. Higgins and Sister Strauss and others, that it may make our job a little bit more easier, that we can bring, it's often so many times that only when the crisis comes that then things are revealed, or people want to then come together and work together. But we have to keep that same, I think, focus even after the storm passes over. And I'm looking forward to working with our leadership that's present here today, and then be able to work with the private sector so that we come together and have the church involved so that we can disseminate practical approaches to our communities and empower them with education and information. God bless you all.
Thank you very much, everybody. This is a great show. Public Affairs, Public Access, Houston Media Source. Thank y'all. Have a good night.
Good night.
Thank you.
Bless you.
Good night. Thank you.